This is Chapter 4's Prefixes and Terminology section beginning on page 130. First we have the prefix a or an. This means no, not, or without. Our term we have is apnea. This means not able to breathe. In this term, the root pne, meaning breathing, is embedded in the suffix pnea. Sleep apnea occurs when breathing stops suddenly during sleep. Next, we have aphasia. This is the absence or impairment of communication through speech. A stroke affecting the language area of the brain can produce this condition. Next, we have atrophy. This is a decrease in size of cells within an organ. Disuse of a muscle can result in muscular atrophy. Excuse me. Muscles shrink as cells decrease in size. Next, we have anemia. This is a deficiency of hemoglobin and or in the number of red blood cells, which results in reduced oxygen to body cells. So anemia is a condition in which there is a lower than normal number of red blood cells or a decrease in hemoglobin within the cells. Next, we have amenorrhea. This is the absence of menstrual periods. Our next prefix is ab, and this means away from. Our term abnormal, pertaining to being away from the norm or irregular. The prefix ad means toward or near. Our term adrenal glands. These are two endocrine glands, each above a kidney. The adrenal glands produce hormones such as adrenaline and hydrocortisone. And figure 4.1 shows us adrenal glands. These two endocrine glands are above each kidney. They secrete the hormones adrenaline or epinephrine and cortisol into the bloodstream. Our next prefix, we have ana, which means up or apart. Our term analysis, separating a substance into its component parts. And our little sidebar at the bottom, we have analysis of urine. A urinalysis, which is urine and analysis, is a separation of urine to determine its components. The following chart shows typical urinalysis findings. The test for color, normal is light yellow, abnormal would be red, which would indicate hematuria, blood in the urine. The test for clarity, normal is clear. Abnormal would be cloudy, indicating an infection. The next test would be for pH, chemical nature. Normal would be slightly acidic. Abnormal would be alkaline, again indicating an infection. The fourth test for protein, normal would be very slight. Abnormal, proteinuria. This would indicate renal disease. And then the last test indicated would be for sugar. Normal would be none, and abnormal glycosuria. This would be indicative of diabetes mellitus. All right, back up to the top again of the 131. Our next prefix would be ante, which means before or forward. Antepartum is before birth. Next, we have the prefix ante. This means against. Our term antibody, a substance that works against germs, produced by white blood cells when germs enter the bloodstream. An antibody is a protein made inside the body by white blood cells. Antibodies work against foreign substances such as viruses. Then we have antigen, foreign protein such as bacteria or a virus that stimulates white blood cells to make antibodies. Antigens are then destroyed by antibodies. Antibiotic, a chemical substance produced by various microorganisms or fungi that inhibits or destroys bacteria or other small organisms. Antibiotics are produced outside the body. They are medicines dispensed by pharmacies. Penicillin is a common antibiotic. So don't confuse antibiotics and antibodies. Remember that antibiotics are medicines to fight against antigens such as bacteria, while antibodies are proteins, immunoglobulins, made inside the body by white blood cells called lymphocytes or B cells. Our next prefix would be bi, meaning two or both. Our term bilateral, this means pertaining to both sides. And the prefix brady means slow. Bradycardia is a slow heartbeat. The prefix con means with or together. Our term congenital means present at birth. A congenital anomaly is an irregularity or anomaly present at birth. Examples are heart defects and webbed fingers and toes. Figure 4.2 shows an image of webbed toes. The pale foot on the left shows a congenital anomaly of webbing in the toes. On the right, another person's foot has normal toes. The prefix dia means complete or through. Diarrhea is discharge of watery waste from the colon. Literally, this term means complete discharge. Waste or feces are loose and watery. Chronic diarrhea can be caused by bacterial infection. A particularly severe bacterial infection, known as C. diff, may be treated with a fecal transplant, transfer of healthy bacteria via a donor stool to a patient. The prefix of dis means abnormal, difficult, painful, or bad. Dyspnea is painful breathing. Dysphagia is difficult swallowing. Dysplasia is an abnormality of the development or the formation of cells. Normal cells change in size, shape, and organization. So it says don't confuse these very different suffixes. Aplasia means formation. Phasia means eating or swallowing. And phasia means speech. Our prefix of ek means out or outside. Ectopic pregnancy. Oh, I skipped two terms, sorry. Back to dysmenorrhea. This is painful menstrual flow, and dysuria is painful or difficult urination. Dysuria is often a symptom of a urinary tract infection or UTI. So ek means out or outside. Ectopic pregnancy, development of the zygote in a place outside the uterus. The fallopian tubes are the most common ectopic site. And figure 4.3 shows an ectopic tubal pregnancy. The fallopian tube is the most common site for ectopic pregnancy, about 95%. This can be a life-threatening condition for a pregnant woman. Normal implantation takes place on the inner lining or endometrium of the uterus. Endo means within, in, or inner. An endoscopy is the process of viewing the inside of hollow organs or cavities with an endoscope. Examples are colonoscopy, laparoscopy, and bronchoscopy. Then we have endocrine glands. These are organs that secrete hormones. Endocrine glands secrete hormones. Examples of endocrine glands are adrenal glands, pituitary gland, and thyroid gland. Epi means above or upon. Epidural hematoma, a pathologic mass of blood above the dura mater, which is the outermost layer of membrane surrounding the brain and spinal cord. Epidermis is the outer layer of the skin. Figure 4.4 shows epidural and subdural hematomas. The dura is the outermost of the three meninges or membranes around the brain and spinal cord. An epidural hematoma, shown in red, involves arterial bleeding with rapid pressure within the skull. A subdural hematoma, shown in blue, involves tearing of veins, which results in pressure building more slowly. Next we have X, which means out. Excision, the act of cutting out, removing, or resecting. Extra means outside of. Extrahepatic is pertaining to outside the liver. Hemi means half. Hemigastrectomy, removal of half of the stomach. Hemiplegia, paralysis of one side of the body. One side of the body is paralyzed, usually caused by a cerebrovascular accident or stroke, or brain lesion such as a tumor. Hyper means excessive, too much, or above. Hyperthyroidism is excessive activity of the thyroid gland. And figure 4.5 shows an image of the thyroid gland. It's located in the front of the trachea in the neck. The thyroid gland produces too much hormone in hyperthyroidism. Next we have hyperplasia. Cells increase in number. The prostate gland is enlarged in benign prostatic hyperplasia. Then we have hypertrophy, enlargement or overgrowth of an organ or part of the body as a result of an increase in size of individual cells. Cells increase in size, not in number. The opposite of hypertrophy is atrophy, where cells shrink in size. Figure 4.6 shows the differences between normal cells, hyperplasia, hypertrophy, and atrophy. And we have hypertension, which is high blood pressure. Risk factors that contribute to high blood pressure are increasing age, smoking, obesity, heredity, and a stressful lifestyle. Hyperglycemia. This is higher than normal levels of sugar in the blood. This condition is common in people who have diabetes. Insulin either is not secreted, which is type 1 diabetes, or is improperly utilized, type 2, so that sugar accumulates in the bloodstream and spills over into the urine, which is glycosuria. Next we have hypo, which is deficient, too little, or below. Hypoglycemia, blood condition of decreased sugar, lower than normal levels. Overproduction of insulin or an overdose of insulin can lead to hypoglycemia, as glucose is removed from the blood at an increased rate. And we have hypoxia, which is a deficiency of oxygen in tissue. Hypoxia in COVID-19. Hypoxia occurs in COVID-19 patients when the coronavirus damages lung tissue, causing blood oxygen levels to fall. A pulse oximeter is a small device that measures oxygen levels in your blood. Small beams of light pass through the finger, measuring the changes of light absorption in oxygen-rich and oxygen-poor blood. Normal results range from 95 to 100%. Values under 90% are considered low, and patients require oxygen treatment. Our next prefix in means in or into. Incision, cutting into the body or an organ. Inter means between. Intervertebral means pertaining to lying between two backbones. A disc is an intervertebral structure. Intra means within. Intrauterine means pertaining to within the uterus. And intravenous pertaining to within a vein. The abbreviation for intravenous is IV. And figure 4.7 shows an intravenous setup for anesthesia administration. Mal means bad. Malignant, tending to become progressively worse. The term malignant describes cancerous tumors that invade and spread to distant organs. Malignant versus benign. The root IGN comes from the Latin ignis, meaning fire. A malignant tumor is a cancerous growth that spreads like a wildfire from its original location to other organs. A benign tumor, then means good, is a non-cancerous growth that does not spread. Next, meta means change or beyond. Metastasis is the spread of a cancerous tumor to a distant organ or location. So this term literally means a change of place. Stasis means place. It is the spread of a malignant tumor from its primary or original place to a secondary location in the body. Figure 4.8 shows an image of metastasis. Note the difference between a primary breast cancer and breast cancer that has metastasized to the lung. Next, we have metacarpals. These are the bones of the hand between the wrist bones, which are carpals, and the finger bones, which are phalanges. So meta means beyond in this anatomic term. The metacarpal bones are beyond the carpal wrist bones. They are the hand bones. And in figure 4.9, we have images of metacarpals. This X-ray image of a normal hand shows metacarpals, carpals, and phalanges. So that's your metacarpals, wrist bones, and finger bones. Then picture B, the arrow is pointing to a fracture, a broken bone, in a metacarpal. Next we have neo, which means new. Neoplasm is any new growth of tissue or a tumor. Neonatal means pertaining to new birth, the first 4 weeks after birth. Neonates who are born prematurely are often cared for in the neonatal intensive care unit. And this is shown in figure 4.10. Picture A shows Benjamin Oliver Chabner, born May 22, 2001 at 32 weeks. So that's 8 weeks premature. Picture B shows Samuel August or Gus Thompson, born August 13, 2001 at 36 weeks. Gus needed an endotracheal tube through which he received surfactant, which is a substance necessary to inflate his lungs. Both children are healthy and a delight to their grandmother. And then down at the bottom, we have additional intensive care units. Note the pronunciations and meanings of hospital intensive care units. First, we have the MICU, the Medical Intensive Care Unit, the NICU, Neonatal Intensive Care Unit, the PACU, Post Anesthesia Care Unit, the PICU, Pediatric or Psychiatric Intensive Care Unit, and then the SICU, the Surgical Intensive Care Unit. Our next prefix, para, means beside, near, or along the side of. Parathyroid glands. These are 4 endocrine glands behind the thyroid gland. These glands are concerned with maintaining the proper levels of calcium in the blood and bones. Figure 4.11 shows thyroid glands. These are 4 endocrine glands on the posterior or backside of the thyroid gland. So these again regulate the amount of calcium in bones and in the blood. Paralysis means loss or impairment of movement in a part of the body. This term comes from the Greek paralytikos, meaning one whose side was loose or weak, as after a stroke. Now it means a loss of movement in any part of the body caused by a break in the connection between nerve and muscle. Paraplegia, impairment or loss of movement in the lower part of the body, primarily the legs, and in some cases bowel and bladder function. Plegia means paralysis, and this term originally meant paralysis of any limb or side of the body. Since the 19th century, however, it has indicated paralysis of the lower half of the body. Next, we have peri, which means surrounding. Periosteum, membrane that surrounds bones. Perianal, pertaining to surrounding the anus. Then we have poly, which means many or much. Polyuria, excessive urination. Our side note, polyuria and diuretics. Polyuria is the excretion of an abnormally large quantity of urine. Diuretics are drugs that promote polyuria. They are used in the treatment of hypertension to lower blood pressure by removing excess fluid from the body. Then we have polyneuropathy. This is disease of many nerves. Polydipsia, excessive thirst. Symptoms of diabetes mellitus are polyuria and polydipsia. Post means after or behind. Postpartum is after birth, and postmortem is after death. Pre means before. Precancerous is pertaining to a condition that may come before a cancer, or a condition that tends to become malignant. An example of a precancerous lesion is a polyp, a benign growth commonly found in the colon. Polyps are often removed via colonoscopy because they may eventually become malignant. Prenatal is pertaining to before birth. And then the prefix pro means before or forward. Prolapse, falling down or drooping of a part of the body. Prolapse literally means sliding forward. Figure 412, picture A shows a normal uterus position, and then photo B shows a uterine prolapse. Then we have pros, meaning before or forward. Prosthesis, artificial substitute for a missing part of the body. Prosthesis literally means to place before. An artificial limb is a prosthesis, literally something placed before as a replacement. Figure 413 shows a sports prosthetic leg. Additional examples of prostheses are total knee replacement and total hip replacement, and this is shown in figure 414. Then we have quadra, which means 4. Quadriplegia, paralysis of all 4 extremities and usually the trunk of the body caused by injury to the spinal cord in the cervical region of the spine. Re means back or behind. Relapse is return of disease after its apparent termination. Symptoms of disease return when a patient has a relapse. Exacerbation is an increase in the severity of a disease or any of its symptoms. Remission, lessening or absence of signs and symptoms of a disease. Resection, removal or excision of an organ or structure. Retro means back or behind. Retroperitoneal is pertaining to behind the peritoneum. The kidneys are an example of retroperitoneal organs, and these are shown on figure 2.4, page 52. Sub means under or less than. Subcostal means pertaining to below the ribs. Subcutaneous is lower layer of the skin. Subtotal is less than total, often just under the total amount. A subtotal gastrectomy is a partial resection of the stomach. Subscapular, pertaining to under the shoulder bone. And this is shown in figure 4.15. Scapula, the shoulder bone, posterior view. The clavicle is the collarbone, and the humerus is the upper arm bone. Next, on page 142, we have the prefix syn, which means with or together. Syndrome is a set of symptoms and signs that occur together to indicate a disease condition. Drome means running or occurring. A syndrome is a group of symptoms and signs of illness. Table 4.1 gives examples of syndromes. We have acquired immunodeficiency syndrome, also known as AIDS. Signs and symptoms: severe infections, malignancy, fever, malaise, and gastrointestinal disturbances. It is caused by a virus that damages lymphocytes, which are white blood cells. Carpal tunnel syndrome. Signs and symptoms include pain, tingling, burning, and numbness of the hand and wrist. A nerve leading to the hand is compressed by connective tissue fibers in the wrist. Down syndrome. Signs and symptoms: intellectual disabilities, flat face with a short nose, slanted eyes, broad hands and feet, stubby fingers, and protruding lower lip. It occurs when an extra chromosome is present in each cell of the body. Mitral valve prolapse syndrome. Signs and symptoms are abnormal sounds or murmurs heard through a stethoscope placed on the chest. These murmurs indicate that the mitral valve is not closing properly. Chest pain, dyspnea, which is difficult breathing, and fatigue are other symptoms. Toxic shock syndrome. High fever, vomiting, diarrhea, rash, hypotension, and shock. It typically is caused by a bacterial infection in the vagina of menstruating women using superabsorbent tampons. Next, we have tachy, which is fast. Tachycardia, condition of fast, rapid heartbeat. Then we have tachypnea, which is condition of rapid breathing. Trans means across or through. Transabdominal, pertaining to across the abdomen. And transurethral, pertaining to across or through the urethra. In a transurethral resection of the prostate gland, also known as TURP, pieces of the prostate gland are removed through the urethra. This procedure relieves symptoms of benign prostatic hyperplasia or BPH. Next, we have tri, which means three. The tricuspid valve, fold of tissue between the upper and lower chambers on the right side of the heart. It has three cusps or points and prevents backflow of blood into the right atrium when the heart is pumping blood. Ultra means beyond. Ultrasonography, recording of internal body structures with sound waves. Using high-energy sound waves to create images of tissues and organs inside the body. The frequency of the sound waves is beyond, or ultra. the normal hearing range. Figure 417 shows picture A, ultrasonogram, showing my grandson Samuel August Gus Thompson as an 18-week-old fetus. And picture B, a 3D sonogram. And then lastly, we have uni, which means one, unilateral, pertaining to one side.